Hello everyone. Today we study Practice 1, Cell Injury, Cell Death, Adaptations, and Tissue Repair. Firstly, I will show you some specimens about adaptation and degeneration. Here we have two kidneys. This one is normal kidney. This is cortex. This is medulla. This line is cortical medullary junction. It's very clear. The normal thickness of parenchyma is around 20 to 25 millimeters, the parenchyma thickness. And here is the renal pyramid. Here is the calyces, the pelvis. Now let's look at the abnormal one. This kidney is enlarged with uneven surface. Please look at the edge of the cut surface here. It's uneven, right? Then the renal pelvis and the calyces are highly dilated to form a big cyst. The renal parenchyma here, is much thinner than normal one. We cannot identify the demarcation between the cortex and medulla. Renal pyramid also disappeared. We call it hydronephrosis. It's usually caused by calculi or tumor in urinary tract. Obstruction of urinary tract leads to the poor drainage of urine. The increasing pressure in pelvis finally caused the atrophy of kidney. Now let's take a summary. The kidney is enlarged and has uneven surface. There is significant dilation of the renal pelvis. The cortical medullary junction is disappeared. This skull is cut along sagittal plane. You may notice there is something very strange. The brain tissue is almost gone, only a big cavity left in the skull. This is hydrocephaly. We know cerebrospinal fluid is circulating in subarachnoid space and ventricles. In some cases, for example, the inflammatory adhesions or tumor in subarachnoid space, it will block the circulation of CSF and leads to the accumulation of local CSF. The pressure will increase and eventually compress the brain tissue. The brain tissue undergo atrophy. In here, it's as thin as the eggshell. The four ventricles dilated and fused into one large cavity. This case is a fetus with intrauterine infection. The pressure of CSF also hindered the cerebral development. If the blockage of CSF occurs in adults, the shrinkage of brain won't be so severe because patient will die before the ventricles expand to this size. Here we have a specimen of heart. This is left ventricle, this is right ventricle. The size of the heart is normal, but the weight is increased. The normal thickness of right ventricle wall is 5 millimeters. The left ventricle wall is 8 to 12 millimeters. Here, in this specimen, the right ventricle wall is normal. The left ventricle wall here and the interventricular septum are thickened, measuring over 20 millimeters in thickness. The papillary muscles here are thickened and strong. Inside of the left ventricle is smaller. The lumen is smaller here. This is a typical hypertension heart disease. The hypertension increases the workload of myocardium. These cells undergo hypertrophy. This is a normal liver. The color here is reddish brown and the surface is smooth. This one is a fatty liver. It's enlarged because of the fat deposition in hepatocytes. The capsule here is tense. In cut surface, the liver are bright yellow, soft, and greasy. Now let's see how it looks like under microscope. Firstly, let's review the normal architecture of liver. This is liver lobule. It is the basic structural and functional unit of liver. Here is the portal area. This is a central vein. It goes through the middle of the lobule and is surrounded by cores of hepatocytes. The hepatocytes here, they arrange in a radiative pattern. These irregular spaces between cores are sinusoid. like it here, here. At low magnification, this fatty change liver looks different. In the center, this is central vein. The liver cell around the vein is no longer radiative arranged. We see disordered arrangement of hepatocyte cores. The fat droplets looks like empty vacuoles with clear edge and various size. Like this one, a large vacuum, and a smaller vacuum, lots of vacuum here. At high magnification, fat droplets looks like a round and empty vacuum with clear edge. They vary in size. This is a small one, another small one. This is a big one. Small vacuums can merge together to become a big vacuum. Like here, this cell, the big vacuum push nuclear and cytoplasm to the peripheral zoom of the cell, makes it look like a fat cell. Now, let's move to the specimens of necrosis. Here is a spleen. The lesion of coagulative necrosis is here. On the cut surface is a triangle. The base of the lesion attached to the capsule. The apex of the lesion points to the hyaline. The texture is firm and it's pale, has a very clear boundary between the lesion and the normal tissue. Here we also see a slight brown ring of hemorrhage surrounding the lesion. It is caused by infarction of spleen, which we will study in the. This specimen is abscess in brain. On the cut surface, we find here is the lesion. It's a big cyst with fibrous tissue surrounding it, making the boundary between lesion and the surrounding tissue very clear. The color of the tissue is white yellowish because there are lots of pus inside. The cerebral hemisphere here on this side is enlarged compared to the normal side. This is a specimen of tuberculosis kidney. Look at the cut surface. The normal structure of kidney is totally destroyed. Instead, we see lots of cysts, or say nodules, on the cut surface, filled with yellowish white and cheesy stuff in it. That is caseous necrosis. This is a specimen of dry gangrene of the foot. Look at this picture. The 5 toes are shrink, dry, and black. The lesion are well demarcated from the healthy tissue. The boundary is very clear here. This is happened because the arterial obstruction usually found in the patients with diabetes. Well, let's move to the section observation. This is coagulative necrosis of the kidney. This picture can be divided into 3 zones. Here, the left one is necrosis zone, the middle one is hyperemia zone, and the right one is normal zone. Now let's look at the necrosis zone. It's pink colored and has very few nucleus in it, right? Very few nucleus. That's because in the last stage of cell death, the nucleus of cell will disappear, right? Now look at the middle zone, the hyperemia. It is characterized by lots of inflammatory infiltration. Now please look here in the background, lots of tiny blue dots in there. That's many inflammatory cells in it. At high magnification, here is the necrotic zone. It's pink colored and has no nuclei. Here is a tubule. The nucleus of this epithelium is disappeared, but the outline of glomeruli and tubules are preserved. This is the very important feature of coagulative necrosis. This is hyperemia zone at high magnification. We found many dilated vessels like this one, and this one. And also lots of inflammatory cells in the background. Lots of them are lymphocytes like this, and this. Now let's move to the last part, tissue repair. Now I will show you the section of granulation tissue. As we know, it has 3 main components, the capillaries, the fibroblast, and inflammatory cells. Let's look at this picture. On the surface, there are some pink amorphous stuff here, like here and here. They are necrotic exudates and cell debris. Below this necrotic stuff, there are many newly formed capillaries, like here, here, and here. They are vertical to the wound surface. Also, we see a lot of inflammatory cells infiltrating in the background. These blue little dots. At high magnification, we find lots of fibroblasts, just like this red arrow points to. They are spindle-shaped or irregular, has plentiful cytoplasm and oval light-stained nuclei. In the background, I can see some neutrophil, like this one, and some macrophage, like this one. As we know, granulation tissue will evolve into scar tissue in a month, while the fibroblast produce a lot of collagen around itself, and then finally, the scar tissue is composed of lots of collagens and the fibrocytes. The fibrocytes is come from fibroblast. When the fibroblast stops to produce collagens, it turns into quiescent fibrocyte. In this picture, the red band here, they are collagen fiber. They arrange in a parallel pattern. And this spindle-shaped blue nuclear here, that's the fibrocyte. Here and here. That's the end of practice 1. Goodbye.